To talk more about healthcare, I'm pleased to welcome Executive Vice President and General Manager of Oracle Health globally, Seema Verma. Seema? Welcome. Thank you. So, Seema, healthcare continues to be front page news everywhere in the world, usually not for great reasons. You have an interesting perspective as the former administrator of the largest payer in the world, which is the United States government, for healthcare. And for several years now, you've been engaging with both our commercial customers and our government customers around the world. You know, what's going on? What's top of mind for everybody in terms of the challenges and problems with costs and all the other things we read about?
So, you know, I've been in healthcare for a long time, but I think that this particular period, I think, is becoming more challenging. And let me just start with some high-level issues that I don't think we contemplated, not in this country or anywhere in the world. First, that starts with just the aging population, and people are living longer, which is a good thing, but we really haven't prepared the system. We don't have the workforce. So that's becoming very challenging, and I think most of us would say, hey, it's hard to get a doctor's appointment, so just getting into the system. And then the other part of it is we're seeing more disease. We look at in terms of mental health, we're seeing cancer happening in younger ages, so the system in and of itself is very stressed. At the same time, we're seeing costs just continue to rise. And for governments, this government, all governments around the world, this is just becoming unsustainable. So if we look at healthcare costs for states and a state budget, Medicaid is actually their largest budget item. For the federal government, it's a third of the federal budget, and these are entitlement programs. So costs are continuing to go up, and I think there's a fatigue from government around how do we solve these problems. And if you look at the history, just in the United States, the history of healthcare legislation and how government has tried to solve these problems is they've thrown money at the problem, right? So they've expanded programs, they've added more services. We think about the Part D program, the prescription drug program, adding more people to our existing entitlement programs. But I think we're getting to a point, kind of a tipping point of fatigue with how the system operates. And I think for the very first time, which you saw with the legislation that passed with the big, beautiful bill, was that this is kind of a pushback, right? So in a long time, we've been adding, and this is the first time there's sort of a pushback where I think the government is saying there's fatigue. If we look at in the UK, the same thing with the NHS, right? It's like we can't continue to sustain these programs. And so we think about what's going on and what is the problem here, like what is the underlying problem? And then there's lots of reasons of what's driving costs, but one of the things that I think we could all agree on is that there's a lot of inefficiency in the system. And that inefficiency kind of gets tied back to we have a lot of people. This is a very people-oriented business doing a lot of work, and a lot of that work is very manual, it's very redundant. So there's, and if we go back to sort of say, why is it manual, why is it redundant? I would venture to say a lot of this is a data problem. And healthcare is inefficient because the data that we have is not, sometimes it's too much, sometimes it's too little, and we don't have data at the right place in the right time. So I'll give you a couple of examples, like prior authorizations, right? So in this country, you want to get a service, you need to have this, the insurance company agree that this is an appropriate service, and the back and forth that goes on is just a lot of time, a lot of energy. And so we're spending about 25 to 30% of our healthcare dollar just on administrative costs. So it's just getting to a point where it's unsustainable. Just this past, I think we're hearing that premiums are at an all-time high in the United States, one of the largest increases. So for all of the money that government has put into it, we're still seeing poor health outcomes, we're seeing more disease, and the system is just becoming more and more unsustainable.
Well, lots of problems.
Yeah, yeah.
Long list of problems. But as I say, you can't fix the problem unless you understand the problem.
Right.
So maybe you can give us a little bit of inspiration.
Right.
And dive into how you think AI, both in health and life sciences.
Yeah.
I mean, I think because both have some similar challenges, and why you're so excited in the work that you've been leading for our team around in AI. Why you think it's helped solve these problems.
Yeah, so that is kind of a grim view of what's going on in healthcare. But I'll tell you what, I couldn't be more excited for where we are in healthcare, and that is the opportunity to use AI to help solve some of these challenges. I think we're at a point now where government can't do it, and they really do need the private sector. So we think about great moments in history, right? So we think about what shapes history. A lot of it is government, a lot of it is war, but it's also technology, and technology has an opportunity to really reshape the future here for health. And I can't think of a better industry that can really benefit from AI, because AI can help. We talked about a lot of the people problem, the data problem, and AI can really come in and help with a lot of those tasks, right, with agentic AI. But even just the understanding of the data and having that real-time data, and not just a ton of data, but understanding what it means, right? So one of the issues, if we think about it in terms of healthcare costs, are drug costs, right? So expensive, because it's very difficult to conduct a clinical trial. And we have, 1% to 2% of the population even participates in clinical trials. Getting people, finding people, matching them to a trial is an enormous task. It costs the system a lot of money, and that's why drugs cost so much money. There's a ton of money in development. But what if we could use AI to match patients, right? So the doctor knows, we can look at the patient, the doctor knows right away, this patient qualifies for a clinical trial, and we can easily enroll the person in a clinical trial. Same thing with prior authorization. The doctor decides they want to prescribe a certain test or a medication. That whole process can be completely automated. So I think there's this incredible opportunity to automate a lot of the manual work, and also to make sense of the data that we have and bring intelligence to the bedside.
Yeah, I certainly share your enthusiasm. I mean, I've had the great honor of being with you in many of these discussions with governments throughout the world, as well as large healthcare organizations, and frankly small healthcare organizations too, in the United States. And I think you're right. I think at first there was some skepticism around AI, as there always is in clinical settings. But now, just with the proof points that we've delivered and the things that we've delivered, even in early days, the line of people lined up to consume the AI is longer than I think that we could. The line has formed more quickly than we could have ever imagined. And maybe you could talk specifically about some of the products that we're bringing to market, and again, why we think they're so going to have such a dramatic impact on this huge inefficiency and cost problem in healthcare.
Right, I think you're exactly right though, right? People, I think in the healthcare system, they're getting to a point where they understand that the problems that they have are not going to be solved by government anymore, right? There's not going to be this big bolus of cash that solves the problem, and that they need to become more efficient. And there's a lot of enthusiasm around AI and what AI can do. I think there's also recognition that the technology that they've had in the healthcare system isn't going to cut it, right?
Yep.
You can't take a 1990s database and think that you can bolt on AI and that it's going to work well. So the industry's been so excited about all of the applications that we're bringing to the market. In our recent healthcare conference, we had the CEO of the Mayo Clinic, the CEO of the Cleveland Clinic, and just a lot of enthusiasm about what we're building.
By the way, they're our competitors' some of our competitors' biggest.
That's exactly right.
Right?
I think that our competitors' customers are starting to understand the power, the value of AI, and that they need a platform that can allow them to use AI to build their own agents, to bring in other agents. And the current products that are out there in the market are not quite cutting it, and they're not able to do it. I think the other thing that I really appreciate, and we can talk about the products in a second, but I think that our approach and Oracle's approach to AI and how we are using AI in the last few months here has become very apparent that what we're bringing to the market is way superior. So you can probably tell them more about how we're building the AI and how that's better.
Yeah, well, we're going to show a demo here maybe in just a minute. But as I said earlier, in a way, you've got to have the data in one spot to actually have any kind of an AI strategy, let alone in a clinical setting. And what you said here was really important. I think it's important to underscore that there actually isn't more money to put into the healthcare system. This is true globally. I mean, governments and payers are running out of money to put into the healthcare system. At the same time, we need to deliver higher quality services to to our customers, and the providers need to deliver higher quality, better outcome services, better outcome-oriented services to their patients, but they got to take a bunch of money out of the system at the same time. It's an incredible challenge. There really is no practical solution to that except for AI. I mean, we're hundreds of thousands of people short in terms of clinical providers just in the United States. We're not going to manufacture, with the birth rate where it is, I don't think we're going to manufacture enough people very, very quickly here to solve that problem. So we've been thinking long and hard about how do we solve this problem? How do we deliver better outcomes? And how do we actually take cost out? How do we help our healthcare customers spend less at the same time? And that's an important part of what we do. So we started, I'm going to show a couple examples.
Yep.
Both the patient example as well as the provider example. So this is a patient example. So here I am as a patient, and I just got my cholesterol report. And what's the first thing you do when you get a lab in isolation? You go to your doctor, you get a test, it comes back. First thing you do is paste it into some search engine or paste it into GPT or some other large language model and say, what does this actually mean? And that's the first mistake, right?
Right.
Because the first mistake is you're only pasting that particular lab and that particular metric in isolation and none of your longitudinal record. So the lab result, while it may not be normal, might still be okay clinically when you consider everything else you have going on and you consider your factors over time. So what we're doing is we're actually putting patients at the, and this is another problem. This has gotten even worse because and a lot of states have these prompt notification laws where you actually get your test results sometimes before your doctor gets, which can be a little scary, right? You know, because if you're not a doctor, you know how to read this, it's a little scary. And then we got this situation where people are going out pasting this stuff, and what happens is that the doctor's call centers are completely overwhelmed as a result. They're completely overwhelmed. So when we're actually doing this, and this is based on our integration, we announced this at our health conference recently in Orlando. This is based upon, coming back to what Clay said, it all starts with OCI. If we didn't have OCI, and we didn't have the large language models actually running in very close proximity to our health applications, we wouldn't be able to do this. But when you ask a question and you receive a diagnosis, we're actually considering your entire longitudinal health record. We're considering everything about you, and we're giving the providers guidelines as to what they're comfortable and not comfortable communicating to customers, and it's all in plain English. None of it is in medical jargon. So you can see that with these embedded engagement tools, the patient portal really becomes a basic hub for healthcare services. It's a trusted partner in care because it's automated using large language models. It's automated using our retrieval augmented generation by taking your longitudinal health record and making the searches contextual. But it's also has all the guide rails of the clinician in it, so that we're not going to actually get into a situation where we're communicating something clinically that a doctor would not want to communicate themselves. And I can speak to it, I can talk to it. It's all completely AI powered. And you can see here, I started to type, I started to talk, and I'm asking very simple questions. How does this compare to my last test? Questions in English, not questions about LDL versus HDL versus VLDL and all these other things, and what does this metric mean and what does that metric mean? Just speak in English. This is very helpful for patients, but it also saves the providers a ton of time and a ton of money in answering questions, direct questions from consumers in isolation. As I move forward, the integrative clinical assistant is also going to guide the patient on the content that matters most. So you get this, first you want to figure out what's wrong, if anything at all. The next question you have is, well, what should I do? What should I tell my doctor? What am I supposed to ask? So you ask a very simple question. What should I ask my doctor? And the generative AI is going to help the customer understand, help the patient in this understand, and actually make recommendations to say, this is how you should communicate with your doctor. These are the questions you should ask. Particularly helpful sometimes for patients who, you have this situation where you go into a provider, the provider has 10 or 15 minutes, and you get out, you say, I forgot to ask that. I meant to ask this, I meant to ask that. So all of this is done before the visit, and then actually drafts a note and said, would you like me to draft a note to the doctor so you don't forget about this when you go into the provider? When you go into the patient, when you go into your next appointment, the provider has all of your questions ahead of time, has all of your contextual information, and patients are in a state of far less worry because they've got this whole process automated. Again, We rolled that out, and without all the infrastructure and without the GPU infrastructure and the large language models running on top of it, we wouldn't be able to deliver that whole thing as a service.
Yeah, and I think it's an important piece, right? So we're looking at this portal, and let me kind of go up one level higher, right? Which is to say, the engagement, by us bringing these tools together, by bringing AI directly to the patient, right? What we're gonna see with our portal is engagement in a level that we don't normally see with most portals. Today, most of us have 4 or 5 portals on our phone because our healthcare data is in many different places. So, the point that you made about bringing together the longitudinal record, that is not happening today. We have our data in all these different places. So by Oracle bringing it all together, and then also bringing AI, what we expect to see in our patient portal is a high level of engagement. And then we don't want to just keep that to Oracle and our providers' customers, but we want to open that up as well. So we're going to allow the healthcare ecosystem to be able to connect directly with our portal as well. So we sort of see in the future that this portal this is your go-to place for all of your healthcare information. You should be able to connect it with wearables, different devices, maybe maybe Weight Watchers, whatever that is that you want to connect your healthcare data with. So it kind of becomes a one-stop shop for the customer. And we think, we've been talking to a lot of the other healthcare companies out there, and they want to partner with us because they want to be able to have a place where they know patients are going to be engaging. One of the biggest challenges for healthcare providers is that patient engagement. So I think that's the power of the portal that we're bringing.
Yeah, it's been stunning to see the engagement, the engagement before and after engagement with this new breed of AI technology. And on the same token, we're rolling out the same thing for providers. Right. So if we flip the script now, and you're in your doctor's office, and one of the first questions the doctors say, well, what can I help you with today? And you sort of feel like saying, well, aren't you really supposed to know? I mean, shouldn't you kind of know that before you show up here? And oftentimes, the doctor has the same problem. There's an overwhelming amount of information. They can't read everybody's chart. They can't read everything. And they actually want to have that same consumer-like experience with the application. They want to ask a very simple question. What should I know about William before I walk into the room? And that's the simple question that they ask. And now they get a summary here of the patient's last visit, of things that may be happening with social determinants of health, not just medical records, but everything we know about that patient, briefly summarized so the doctor walks in to a far more engaging interaction with this customer. And this is a preview of, well, this is actually generally available now. This is our new electronic health records, and you can see, just like we saw in the financial crimes investigation agent, where you have these timelines over time, that at any given point I can click on this and see what's happened with this patient over time in a very easy to use screen. This is all runs on tablets, it runs on mobile phones, the form factor automatically resizes itself. And again, it's all built with AI built in. There is not a non-AI version of this. The AI is the underlying mechanism that powers the entire EHR. We just went through, as I said, regulatory approval, and you're going to see the same benefit that the consumer gets, the doctor gets the same as well. Doctor wants to know about A1C trending over time. They have the same problem where you got a stack of PDFs and a stack of papers that are very difficult to get longitudinal information about, and therefore very difficult to have an intelligent, contextually aware conversation with patients. All of this is now available. And if you'd like, as a provider, all the screens are really not necessary because all of it can run in the background with a listener, and that's how most of our providers have actually chosen to uptake the new technology. You simply place the listener in the room, the listener can be a mobile device, and the whole thing is automated. The whole thing is automated. The whole conversation between patient and provider is automated. The orders, the labs, the summaries, the patient discharge notes, and just like our financial crimes investigation AI agent, at the end, the doctor still has to sign off on it. It's orders of magnitude different experience for patients and providers with healthcare systems, and we're just hugely excited by it.
I think it's a game changer for the industry, right? So let me just dig in a little bit deeper. You talked about the patient summary, right? And that's a short summary, but think about what it's like for the doctor. Let's say they're dealing with a 70-year-old patient, right? There's multiple comorbidities. We think about the Veterans Administration that we're working with, right? And they're going to extend the Oracle EHR across their entire enterprise. And this is really important because you can think about the complexity. And they're having to go through sometimes thousands of pages of healthcare information. And a lot of times things get missed, or we're not addressing something. The data's there, but the physician may not see it. They're a very short period of time. So the ability to have that summary is a game changer. Yep. And like you said, the SDOH, all of those different things. And the automation, I think the other piece that's important is the autonomous coding, right? So the other thing on the screen there is that it'll recommend which codes. And this is an important piece, because if we think about it, for the healthcare industry, we're spending 25 to 30% on administrative costs. A lot of that is around billing. And the cost to collect for providers is about 5%. So all of that money just to be able to get the bill paid. And we're automating that entire process. So if we think about it, the whole billing process, at least in the United States, was built off a paper system, right? And then when we went to digital records, we just basically took that process and digitized this process. But with AI, we don't need to do all those things. We don't need all of the different middlemen to be able to get this claim paid, right? We can actually do all of that with AI. And so our EHR sort of starts as, it's almost a misnomer to call it an electronic health record, because it's really a system of intelligence. And it goes way beyond just the patient-doctor interaction. We started there. But we're trying to address all the problems across the entire ecosystem. So that autonomous coding piece is really solving a lot of the friction between payers and providers. Not only are we going to try to make claims payment easier, but even just the prior authorization, all of those things that happen between the payers and providers, we're introducing those solutions. And it's ironic that it's actually the payers that are coming to us, and they're saying, look, after the big change event, there's a lot of concern about security. And so being able to have the Oracle Cloud in the middle of this, helping with those transactions, is really important to the industry. It's safer, it's more secure, and also we can use AI to automate a lot of those processes. So that's one piece on the payer side. And then there's the whole other piece with clinical trials, right? So if we think about it, most clinical trials and a lot of research is only happening at big, large academic centers. So if you're lucky to go to one of those, you may get connected with a clinical trial. If not, you never know what's going to happen. And so what we're able to do with AI is we're able to do that matching inside the clinical trials. But where we're going is to be able to use that EHR, not to actually do the clinical trial right inside the electronic medical record. Today, with clinical trials, what's happening is that they have to go to an entirely different system. So they actually physically move the data from the electronic health record into the electronic data capture for the clinical trial. So you can imagine a lot of the back and forth work and the retyping, then you gotta have somebody to check in all the information. So, our electronic health record is not only addressing it's actually providing payer solutions and also the ability to help clinical trials and research on that end of the spectrum. So it's doing more than just helping the doctor and the patient. It's a much broader view.
Yeah, well, that's terrific. I mean, thank you for giving us hope and for sharing the solutions, because I really do agree that bringing this whole consumer-like experience to healthcare, both for patients and providers, is what is going to be game-changing. And obviously, your passion and knowledge in the space has been a big driver in helping us get to this point. Something else interesting happened while we were bringing all this data together for healthcare providers, and that is we actually started to realize that there was more utility in the data, in the collection of data on the AI data platform that we've used to power these healthcare systems, that just for the providers themselves. But actually, as we become intimately close to these providers, we realize, particularly in the United States, that a lot of providers, a lot of healthcare providers have cash flow problems. And for those that are publicly traded, when they report out their cash flow in days. Report out their available cash in days, not weeks, months, years, days. That's how much cash they have on hand. And they've got to make decisions around payroll, ICU, equipment for the ICU. These are real decisions that very big healthcare systems have to make. We looked at the data that we had, and we thought, this might be. And we asked questions about how do you finance these systems? The banks don't really know a whole lot about what we do. They don't know about a receivable flow, and it's not that they had a receivables problem, but they actually just have a cash flow problem. It's not that they're not going to get the money, but when they're going to get the money is an acute problem, no pun intended, for healthcare systems. So we see the same kind of transactional flow happening across the board in our whole applications. You can see some of the stats there, and But we particularly leaned into a couple industries, and we're going to talk about a few of them here, where the traditional financing models are very complex. And the financing models really are complex because the banks, the financier in this case, in this situation, does not have access to real-time data, and the data that they do have access to has very little qualitative information about it. Very little qualitative information associated with. So we, through the course of conversations with the healthcare providers, construction companies, we're going to talk about a few different examples here, and the banks, we actually found out that the AI data platform is a wonderful vehicle for banks to learn a lot more about their customers and for customers to have a much better relationship with their banks. So we're going to talk about embedded applications that benefit, why it benefits the banks, and also why it benefits the business, or in this case, the healthcare provider. So with that, I'm very pleased and honored to have Leah, who's the Managing Director of Global Head of Payments and Embedded Finance at JP Morgan, and Jeff, the Managing Director and Head of Global Lending for Trade and Supply Chain Finance at Bank of America, to come talk with us more about this exciting platform. Leah, good to see you. Thank you. See you. So, thank you, Leah. Thank you, Jeff. For being here. I gave a very brief example, a very brief introduction to embedded finance, and a little bit about healthcare. But I know it's more than there's more than healthcare involved. Jeff, maybe just go down the road. I'll start with you. Could you give us a little bit of a preview as to why this is so exciting, and what we're actually doing here together to better serve our collective customers?
Yeah, so Mike, as you alluded to before, so if you think about healthcare providers, they're our clients as well. And for years, they've had working capital issues, and they come to their bank and say, look, we've got a working capital issue. We look at the model and we say, okay, it's not a payer problem. There's no shortage of customers, and what you realize quickly is what you have is just a working capital problem or a cash flow problem. And if you think about the way that banks help our clients solve these things, each industry becomes kind of a little bit different because it's got its own characteristics. And we think about healthcare. Healthcare, the receivables can be hard. So the banks can do certain things. Certainly you have credit lines. You can, in some cases, hospitals can access the municipal bond market. But some ways that we traditionally help to free up cash flow and accelerate working capital are difficult for the banks because we don't have what we need in terms of okay, who's going to pay this and when and how much. And for years, we chased that data. Right? And Seema talked a little bit earlier about the data that's being followed to get a better health outcome. Well, we at the banks, we're sort of chasing that same data. Somebody could think, well, what does the bank care about a certain procedure and how much of that gets paid and when? And the reason that's important to us is because if we've got this receivable and we're trying to accelerate cash, we need to know what's going to be paid and when. Mm-hmm. And it became clear to us as we went through this process, and Mike, you alluded to this earlier, that some of the data that you had aggregated, consolidated, and then were very good at being connected to was exactly the same data that we would need to provide additional working capital options. And as we thought about that, we said, okay, well, if we could do that, then we could layer in some of the AI predictive models on top of that. To be able to say, okay, well, now we think we know with a bunch of procedures that happened what the expected payment will be and when, right? And any of you that have experience with healthcare know that the original invoiced amount has very little relationship with what's actually paid at the end of the day. So we needed a way to get from point A to point B. And it became clear to us also as we saw that the availability of data that was coming in that Oracle had access to, not only that, but also you were very good at layering on that AI at the end of the process to say, we're going to give you a predictive model that tells you what's expected to be paid. And that solves our big problem, which is we don't know how to get from point A to point B in terms of what's invoiced and what's paid. And by doing this, we're able to help accelerate cash.
Thank you. Your perspective, Leah.
Yep. First of all, great to be here. So, at JP Morgan, we are partnering with Oracle to embed payment services and financial services directly into the Oracle ecosystem. so that in Oracle solution like industry applications, Oracle can provide those payment services and relevant financial services to their clients directly in a very seamless, integrated, and scalable way. And I think for the banks, in my view, it's a very meaningful evolution of how financial services are accessed and distributed, right? Really through a platform approach. And by doing so, I think there's tremendous benefits to our clients and to Oracle's clients as well, right? Think of it as a very streamlined, automated workflow so that the end clients have ultimate data and visibility and transparency of where the payments are. And then to Jeff's point, also the data plays a huge role here in delivering those benefits, especially in our strategic partnership. Like as I think about at JP Morgan, we, in the payments division, right, we process about more than $10 trillion of payments every single day. So we have a tremendous amount of data around, who pays whom and when and how and where, right, in which currency. And that coupled with the enormous amount of data in the Oracle right, industry applications, with that partnership, we know a lot about every single client. And I think that is a very powerful way to serve our clients, to have that intelligence to serve our clients.
Yeah, well, that's very helpful. Thank you. Jeff, when we first started talking about this partnership, you gave me some stats about how much money was sitting on the sidelines in each one of these industries waiting to invest. But the problem was that the people willing to invest didn't know enough about the industry and couldn't get enough of the qualitative metrics to feel comfortable about this investment. So this just changes that, we think. But ultimately, how does it benefit you as a bank? What's the ultimate benefit to the bank? How does it change your unit economics? How does it change your investing philosophy?
So we can kind of look at it along two vectors. So the first is we've got clients who are looking for better working capital management, so we can help them with that, right? I think that's the first thing, right? As we serve our clients, and we think that's a good thing because as you both have noted, you've got hospitals in the United States alone that are struggling financially, right? And it's not because of lack of customers, it's not because of lack of high quality payers. It's for free cash flow and working capital reasons often, so we can help. The second thing is part of our business is connecting our clients to investment options, right? As we think about this, if we think about the opportunity to take some of what is out there, predictable receivables, in a way that hadn't been there before, with high quality payers, we can translate that into investment opportunities for the capital markets. Now, I can tell you the capital markets have, to your point, Mike, been waiting on the sidelines for great investment options. They're always looking for things that are, all over the risk profile. And for us to have ways to be able to wrap things like receivables and say to them, look, not only do we have this investment option for you, but it's coming from a bank in a regulated environment with a risk management profile under a regulated environment, and we've got it and we're putting it out into the market. That means something to an investor, right? It means, okay, so there's been work that has been done behind the scenes to get us to the point where we think we have an investable asset. And that work, again, I think the reality was 5 or 6 years ago, there just wasn't enough out there. We were chasing data in 1,000 different ways. And people underestimate, I think, what I always call the mechanical side of that. We can do credit analysis pretty easily, but what we can't always do is say, like, how will the mechanical parts of this, where is the receivable being created, where is it housed, how will it get from wherever it sits to the bank system so that we can then do something with it and wrap it and send it to the markets. All of that stuff is impactful to an investor, right? A smart investor looks at all of that and says, look, I don't want to take my chances that this receivable becomes something else in the course of its lifetime. And I think as we track just historical data, performance data, all of the data that becomes available, all of that starts to become solved, and then we've got investable assets. So we've got on one side of it, we're helping our clients be better payers, and on the other side of it, we're creating investable assets for our clients.
So are these investment products that you can create as a result, are these products that you previously couldn't create or you had to create with a different rating or different risk profile associated to them?
It's a really it's a really good question. So we're in the business of pricing risk, right? So part of that is, I said, the credit risk, which is easy, but the other part of it is just as important, and that's, people underestimate that side of it. And I think the reality is, if the receivables were really hard, the banks just kind of sat on the sidelines. So as you think about just some industries like healthcare, like construction, where there was uncertainty of payment from a bank's perspective, because remember, by the time the data got to us, we only had access to small portions of it, right? So all of it just looked like it was very unreliable. So in the context of a regulated, risk-managed bank environment, there just wasn't a way we could get comfortable with the predictability of outcomes. So for us, we parked that part of our toolkit, and then we moved on to what we think we could do, right? Create a facility or municipal bond market or whatever it might have been. But that's the difference between what we had before and what we had.
I think as we've talked, Jeff, it's been quite interesting to understand the bank's philosophy on all this. And it's not that, and we're going to talk about construction and retail and more than healthcare in a second, but it's not that the bank necessarily is interested that Medicare is going to reimburse the provider for a hip replacement. But what you're more interested in is to make sure that that person doesn't get readmitted to the ER in the next 30 days with an infection as a result of that, because that actually changes the reimbursable for Medicare in a value-based arrangement. And that's the level of data that you need real time. And obviously, for one patient, easy. Millions, hundreds of millions of patients, we'd have to scale that over time. Very difficult to do without an AI data platform, kind of constantly monitoring and scanning for anything that could change the risk profile as well.
And this is to your point, people might think to themselves, why would a bank be interested in that? We're very interested in that because it's predictability of outcome. It's the predictability of us getting repaid and an investor getting repaid. So it's very important to us.
So
Mike, I was just going to add one more thing, right? So before we leave healthcare, right, is that the government in and of itself is now moving more towards those value-based payments, more capitated payments where providers are not getting paid on more real time. It's more after a year of you've taken risk. And so for providers, the need for cash flow has really increased dramatically. So I know our providers are very happy about this solution as well.
Yeah. We could go on for a very long, just on healthcare alone, there's just so many interesting dynamics. And Lee, I'm going to shift gears for a little bit. Retail, restaurants, construction, all of these other industries where we're managing, all of these transactions, and either at the point of sale or payment or money changing hands, using the Oracle platform technologies today across so many different industries. How do you see the different needs in embedded payments, across these different vertical industries? How do you see that evolving, and why is the automation so important to you?
Yeah, no, great question. I think, across all the industry verticals, I think there are common themes, right? No matter which industry vertical, we want the payments to go out in a very secure way. I think we want to know, or Oracle and the clients want to know the transparency, where is my money? If something goes wrong, they want to know where the payment is stuck, right? So I think there are foundational basic needs of security, transparency, right, and the optimization of the payments. Those are universal. Then to your point, like for different industry verticals, there are nuances. We talked a lot about healthcare. Seema, you mentioned it's a very complicated ecosystem with payers and providers and regulation and HIPAA compliance. So that really, it really requires a lot of the payments handling, right, for data privacy and whatnot. You think about another vertical, consumer retail, you mentioned, it really fast evolving into, right, already omni-channel. Right, in-person, in-store experiences with in-app purchases, with online, like how do we deliver that payment experience in a holistic way? And today we talked a lot about AI, and people talk about agentic commerce, and in the future maybe all the agents will do all the purchasing and whatnot on your behalf. Then we need to think about fraud and authentication and liability shift and all those very interesting future business model, current business models that are evolving very rapidly. And I think with the power of data combined in our partnership and with the AI models, on top of the data, that's where what I meant earlier, like the payment intelligence, right? How do we deliver that insight into our Oracle clients so that they know the fraud prevention, they know how to position cash, how to really mobilize all the transactions to add value to the ecosystem.
Yeah, and so in some ways, this automated embedding into the applications, it becomes another distribution channel, for the bank, of compliant distribution channel. We know a lot about the customers. We can automate KYC, all the things that need to be done. We've got that data. All of that data available as part of our industry applications just becomes a wonderful distribution channel, and frankly, far easier for consumers to consume because it's built into everything that we do.
Totally. It's like a pre-built enterprise grade, right, banking and payments core that's already compliant and extensible.
Yeah.
So I think that is really where we're headed in co-creating this model.
Well, we appreciate it. So I'll ask you both the same question. We're not the only technology vendor in the world. Why partner with us? Why Oracle? What's special about this relationship between Oracle and the banks?
Look, you go with what works, right? And so there is, as I said, we spend a lot of time chasing data to try and sort of predict outcomes, right? As I said, we're in the business of pricing risk, and predictability is a big part of what we do. And I can tell you, we've burned a lot of calories on this in the banking world, trying to sort of figure out how we can get from point A to point B in certain industry verticals. One of the things about, as I said earlier, when each sort of financing opportunity grows up in a certain industry, it becomes bespoke to that industry to a large extent, and it's hard to move from one to the other, right? You have to have a level of expertise in each industry. And what we realized, I think, about Oracle is you're doing a lot of the really hard work. We don't always need to know, we talk about healthcare, like following data to get to a better health outcome is harder than what it is that we need to do. We're just sort of looking for, at the end of the day, we need predictability of payment. That's a part of it, but it's not the hardest part of it, right? So you guys are doing the hardest work, but a lot of that is stuff that's really, really useful to us. And what we found is it doesn't look that different in healthcare as it does in construction, as it does in retail. So now, not only have we been able to solve and unlock some of these industry verticals, we've actually been able to migrate from vertical to vertical because we realize like predictability of outcome in an Oracle-built model often looks the same across industries, but it's the same usefulness to us.
I think it's a terrific point, Jeff. It's like we're not building a financing vehicle that is specific to an industry. We're building a platform that has industry context built into it. It's going to give you the data that you need, but it actually scales across all the industries that we serve.
Right, and that's not what we expected at first, right? We expected to kind of stay industry by industry, and it was only after going down this road a bit that we realized, this is more scalable and malleable than we thought it was, which I think is going to be a really good outcome.
Right. I think for us, the partnership with Oracle is really critical in terms of we share a lot of common values, right? I think, Mike, you talked about in your keynote at the beginning of the conference, right? Scalability, security, full stack advantage. I mean, those are things that we look at our, JP Morgan's platform. We share the same value, and then we think by partnering with Oracle, that's a force multiplier. Right? The scale is just going to be that much more, even more global, more scalable, more extensible. And the security is really a critical component. I think you also mentioned, right, whenever you add in a new component into the system, there's risk. By integrating the two global platforms in a very digital, right, API-driven way and modular way, I think that creates this tremendous platform and infrastructure layer to serve our clients even better and more seamlessly.
Yeah, well, that's much appreciated, and we do resonate with the shared values. I visited both of your organizations in person many times now, and even been on the trading floors, and I can tell you that the passion is very contagious for this access to real-time data. So much appreciated. And to be clear, we're going to market together right now in construction, in restaurants, and healthcare, and certainly plan so much more to come. So I'll finish where I started. Is that good things happen when the data is all in one place. And our ability to aggregate operational data, both qualitative and quantitative data, and to deliver that as a service to you so that you can deliver that as a service back to our collective customers, we can't thank you enough for being a part of that. we can't thank you enough for pushing us and inspiring us and helping us to find this product, and I'm so excited about what's to come. Thank you, everyone.
Thank you, guys.
You.